Valley Children's Hospital in Madera confirms a child there is showing symptoms of a rare syndrome. It's called multisystem inflammatory syndrome in children, or MIS-C. It affects major arteries and the heart. The patient being tested positive for COVID-19 antibodies. And now doctors are asking parents to be on the lookout for certain symptoms. And here now to tell us more, we bring in Dr. Haley Nelson, a pediatrician at Valley Children's Charlie Mitchell Children's Center. Dr. Nelson, thank you for joining us. We appreciate it. We're talking about multisystem inflammatory syndrome in children. Is this linked to COVID-19? I think this is the big question everyone is concerned about.
This is a big question, and certainly one that lots of researchers and doctors have been looking at. As of Friday, May 14th, the American Academy of Pediatrics published on their healthychildren.org website an update for parents, because lots of parents are concerned that this might be something that they should be looking for in their children. So on their website, they have come out to say that the CDC has made a connection between COVID-19 and this disease.
Are they saying that COVID causes the syndrome, or does it make the symptoms worse if a children does come down with that syndrome?
I think it's still early in that we're trying to learn more about this, but we know that having a COVID infection, that this can be something that we need to be watching out for children.
All right, so what are the symptoms? If you can run down the list so that parents watching will know.
Sure thing. So symptoms that we want parents to watch for are common things that I would have any parent call me for to begin with. So if your child has a fever that lasts for more than 24 hours, if your child has a new onset rash that you're concerned about, if there are any difficulties breathing. So we certainly, with COVID, we worry about this being a respiratory virus. So if your child's having a hard time breathing, we want you to call their doctor. And then if they have any abdominal pain, if they're vomiting, they have diarrhea, so any GI symptoms. And last and most importantly, if your child seems more sleepy than they should. So if you have a child who's normally pretty perky and they're acting sick and just not acting like themselves, that's a great time to call your doctor so that we can help you out.
Is this syndrome typically contagious? I know obviously if it's connected to COVID, we know that is very contagious, but the syndrome in itself, is it typically contagious?
So that's a great question. I don't know that we have a full answer to that yet, because we're still finding out how long people are infectious after they've had a COVID disease. And so once someone's had it, how long can they transmit? And I think that that's up for debate right now, and certainly something that's being looked at.
We know that children on the East Coast have tragically died from this, but and we know that there is at least one case in at the hospital there. How serious is this? What are the odds of recovery, and how much of a concern is this?
So I think that this is a real concern, as something that we all as physicians need to be watching out for our patients. But I want to encourage parents to know that this still is a very rare side effect. So yes, we know that now that there is that link, but that's not what typically happens to children who come down with a COVID infection.
Well, we hope that the child that is currently at the hospital is doing well. I know you can't offer specifics, but how does that case look?
So I'm actually an outpatient pediatrician, so I'm not involved in that case. But I am hopeful that the team is, I know that here at Valley Children's, we're doing everything to be able to care for all of the children.
Yeah, of course you are. What should children do about wearing masks? I know there are recommendations that very young children should not be wearing a mask, but what are your thoughts about children wearing masks to protect against COVID and this inflammatory syndrome?
Sure. So wearing a mask is an important way that we can reduce transmission of a viral illness. So when I wear a mask, I am protecting you, because I'm then keeping, if I was potentially sick, but not yet showing signs and symptoms, I'm then not transmitting the virus across. And then likewise, that's why you would wear a mask for me, so you're protecting me. And if we both are wearing masks, we're going to decrease the risk that we're spreading disease. One of the things that's scary about COVID is that there is asymptomatic spread, and so we need to be mindful of the fact that people can be spreading this virus before they start to show symptoms. And so that's why mask wearing can really be beneficial. I have some examples of masks. So this is a child size mask that was sewn by one of the local teachers for us. So this is for ages 2 to 6, and then the junior size all the way up to adult size. So there's ways to make fabric masks at home, and all that you need is 100% cotton and 2 folds. So as long as it's folded over, you've got a good seal on your mask so that it fits well. It's really going to be able to help protect you.
Yes, it has to be tailored to the size of the child. Dr. Haley Nelson with Valley Children's Charlie Mitchell Children's Center, we appreciate your time today. Thank you.
Thanks for having me.